have to compare the interoral latency difference between left and right side beside the morphology. Alright. So I've been given this topic, hearing aid and cochlear implant. Actually, I had no idea that this is just the ENT students here. Are there anyone not ENTs or already ENT specialists here, or these are just students, the master students? Yeah? Alright, okay. So I hope this hearing aid and cochlear implant is actually a very big topic in audiology. For us, this is 2 semesters punya courses, We have hearing aid 1, hearing aid 2 in semester 2. So when I've been asked to cover in 45 minutes, I hope it will be a very general one, and then you can ask me later. And I have to admit that because of right now I'm doing admin, I'm focusing more into cochlear implant clinic rather than doing the hearing aid clinic, because hearing aid itself is a very big area and it needs to catch up, a lot of things to catch up. Alright, so I consider myself more of a cochlear implant audiologist. Anyway, I'll give you the basics. I saw this photo in one of the hearing aid centers. Put this: Grandpa, I want you to hear me. What do you think we want to fit someone with hearing aids or cochlear implant? What's the purpose? Sorry? Quality of life, yeah. Is there any difference if you are fitting hearing aids for adults and children? Do you think? What's the difference? Okay. What's the difference between fitting hearing aid, pediatric and adults? Huh? Compliance? Probably I make it clearer. My question is that what's the aim of fitting a child and also adult? For speech development. That's for a child. All right. So, and for adults, for communication. So when we feed adults, our purpose is really to rehabilitate them, basically to reconnect them to the hearing world, right? So they're probably missing. They probably people talking, especially in noisy environment like in restaurants ataupun pergi kenduri orang cakap-cakap, they're missing. So sort of like isolated, that's it. Right? So when we feed them, our purpose is really to reconnect them to that hearing world. Right? But when you feed a child, your purpose is really for them to develop speech and language. Right? So when the aim is different, then how we feed a child and adults will be different. That's in general. Okay? So, yeah, this is just another, when you see a baby, mothers want to talk to babies, they will be whisk, playing and so forth. Yang itu kita tak buat with adults, isn't it? Tapi with children, yes, you want to play, you want to talk, you want to swim with them, and so forth. So, of course, the way we feed pediatric babies especially would be different compared to adults. I don't know whether this works here. It doesn't work. But actually, ni keponan last week, we all baru ada interactive punya teaching and learning workshop. So keponanan. Tapi tak jadi, tak apalah. I tried this poll everywhere, but my question is just trying to look at how many of you have actually seen hearing aids? Seen Tengok betul, pegang dan
December.
kat tangan. Alright. Ni tak kira kalau tengok gambar tak kira ya. Gambar tak kira. I'm talking about you pegang in real life. Okay?
Of course.
Okay, how many of you have seen a cochlear implant? So almost like everyone. Good.
Ya. Tak pernah first time.
I'll start with hearing aid first. Sorry, who are hearing aid candidates?
Hearing aid.
In general? Alright, the answer here was in general, anyone with hearing loss, right?
Siri.
In general. Alright. You want to be more specific? Tadi in general. Yeah. Okay. Are we going to feed just those with sensory neural losses? Do we feed those with conductive losses? Mixed loss?
Yes.
Are we going to feed those with mild hearing loss? Or just those with moderate to profound losses?
Depends.
Do we feed mild hearing
Tak
loss?
semua-semua cannot.
No. Ken? You want to elaborate? Mm-hmm. Very good. It's actually mild losses. Our concern is more with pediatric children at school because this can lead to academic failure. Alright? They can be inattentive and then kata apalah budak ni, macam daydreamer and so forth. Tapi they actually have this loss. And then you have to also differentiate whether that is a purely mild sensory neural loss or ada juga this problem what we call as a central auditory processing problem. Alright? Because when they have a central problem, then they have difficulties in that background noise. Classroom very noisy kan? Classroom very noisy. Ya, budak-budak kan jerit-jerit, bising, semua orang bercakap, especially kalau dah break time, lunch, recess tu kan, very very noisy. Semua berlari-lari, semua bercakap and so forth. It's a very very challenging. They need to focus and it's very hard to focus. So, in cases like this, we also feed them with hearing aids. It can be a mild power hearing aid, but we do when it is difficult for them. We also feed those with, we say it's conductive losses, usually it can be treatable, right? They are treatable. But if you treat them and then the conductive still persists, it's still there, then you also may want to consider, treating them with hearing aids. For adults, if it is a mild loss, and they don't usually adults, they don't even realize that they have a mild loss, unless you actually measure it. Right? If they actually do a hearing test and they probably realize, oh, okay, there's a mild loss there. In cases like that, we probably don't bother. Tak ada problem, tak ada masalah. Tapi ada orang, it's a mild loss, but a significant handicap. These are the people we also need to address. Alright? Despite a mild loss, the handicap they are having is significant. So these are also people that we need to help. Alright, so these are different categories. Of course, in general, sensory neural, moderate to profound, you really need to. Do we feed those with unilateral losses? Yes? Right? Yes, we also do that. What's the reason and what's the purpose? Usually kalau dulu-dulu tu memang rasanya people don't bother to do anything pun, because we have seen adult cases yang just make do with one side. A profound loss one side, and normal hearing or near normal hearing on the other, you just cope with it. Tapi now single-sided deafness is also a big issue. We've just heard last week or so, there's approval for cochlear implant even for single-sided deafness, FDA approval, yeah? Alright? You know, in the Europe, SSD, for a very large numbers actually gone through cochlear implant. Dulu kita probably tak consider pun them. Alright? But also SSD, they're probably looking for BAHA, or there's other options as well for single-sided deafness. Alright? So, but of course they can start with hearing aids if you want to. Again, in cases, if it is adults, we consider how difficult the situation is without the hearing aid. If they don't bother, kita pun tak bother lah. Tapi kalau kita punya concern is really children. Ya, yang ini need a lot of counselling to parents, sebab selalunya parents akan deny. My child can hear, why do you want to fit hearing aids? So needs a little bit more counselling there. What's the reason or what's the purpose for us to suggest hearing aid feeding in single-sided deafness?
Cadangan dia tulis.
These are different types. Ini tak masuk lah hari ni. Kalau siapa yang tak pernah pegang lagi tu, dah tengok gambar, tak masuk lah. You dah tengok. But I just want to say there are different types. Probably initially dulu-dulu ramai yang mungkin pakai ni, what we call behind the ear hearing aid, whereby you really need to use ear mold. Ear mold ni pun ada different types of ear mold. You can modify, and the material is also different. Kalau yang profound losses, we do ear mold yang probably full shell punya, kita kata, to make sure we cover the ear so that there will be no feedback. Acoustic feedback ni yang kadang kalau siapa yang dah pernah tengok, dia bunyi, dia pergi dekat je dengan keluar dia bunyi kan. That is the acoustic feedback. We don't want that to happen. Alright? Okay, itu kalau macam tu, you tengok balik dia pakai tu betul ke tidak, earmoldnya masuk ke tidak, ataupun earmold dia loose ke, you need, ataupun earmoldnya buat tak betul ke, ada crack ke anywhere, macam mana bunyi boleh keluar. It shouldn't be. Alright, tapi if it is a mild losses, then the earmold can be done like we call skeletal punya earmold. So dia a bit harder, dia guna material yang harder. And then it basically it's just it's like open fitting jugalah, sebab kita tak nak penuhkan dia punya, you know, the telinga dia tu with earmold, because they won't like it. Alright, so and what is more popular now is this, what we call is receiver in the canal. Tadi kita cakap pasal receiver in the canal, hearing aid, RIC. This is a more popular option now, probably, but it is not. So because what you see, they are using slim tube RIC. Slim tube ni tak nampak kan, so cosmetically it's very nice lah. Orang tak nampak pun you pakai hearing aid, and it's getting smaller and smaller, right? So RIC is an option, but probably not for pediatric cases, not for children. Adults okay, alright. These are the different styles we said about. These are all behind the ear. It's just because the conventional BTE, as what I showed you. And then the slim tube too, what we call as open ear BTE. That's another reason, because they don't use ear mold. They don't use ear mold. It's just a slim tube, and then there's a dome. This dome you can change based on the severity of losses. Alright? The severity of losses. If it is more severe, then you choose a dome for that severe profound macam tu. Okay, tapi of course ini tak boleh ganti kalau yang very profound losses. Kalau profound losses, you will still ask them to wear the one with the ear mold yang full shell. Sebab kita nak bagi high power, right? So walaupun ada dome for the severe losses macam tu, I would recommend kalau yang macam ni profound losses, probably go for the full shell earmold, or might as well just consider cochlear implant. Alright, so that's behind the ear. And of course kita ada, this is the old one in the ear, hearing aid. Probably you still see for older people wearing in the ear hearing aid, we call it. You can see it in the ear hearing aid is very small. So if we want to fit in the ear hearing aid to adults, we also have to look at dexterity problem. Lagi bagi orang tua tu, dia duduk seorang-seorang kat rumah and then pakai hearing aid yang kecil-kecil ni, nak pegang, nak masuk pun jatuh. Tak nampak dah. Tergelek itulah. Hari tu ada one of our patient said, carilah hearing aid bapak dia. Kat mana hearing aid? Jumpa kat mana you know? Dalam mesin basuh. Masuk dalam mesin basuh. Semua cari, anak-anak cari. Cuba tanya tadi pergi rumah orang tu, ada tak kat Penang? Ada tak kat sini? Ada tak kat Shah Alam? Ada tak kat itu? Semua duk cari. Dah lah pembantunya jumpa masa nak sidai baju, jumpa dalam mesin basuh. This is the problem, yeah. So we have to, when we want to fit that hearing aid, we need to ask all those questions. Who are you staying with? Who are looking after you? Who's going to take care of this hearing aids? Kita tak nak in the drawer. Sebab dia tak tahu macam mana nak check hearing aid, bateri ada lagi ke tidak dan sebagainya. Alright. So, and then of course ramai juga yang suka in the canal hearing aid. In the canal hearing aid, really you don't see anything outside there. Tak nampak slim tube, tak nampak anything. It's a very very tiny. In the canal. So ada satu, tak tahu lah you nampak ke tidak, ada satu pemegang canal dia macam tu untuk kita tarik keluar balik semula the hearing aid. So again, this is because it's deep inside the canal, you push it in, but it's good for macam tadi yang ada high frequency losses because of other natural the resonance of the middle ear as well, and it's close to the tympanic membrane, so it's actually good for high frequency losses. Alright, and this is sort of like fitting guide for canal model. Again, because it's very small and all the electronics are inside the body of that very very small hearing aid, then it's not suitable for profound losses because you cannot give high gain there. Because the position of the microphone and the receiver is very close. That will increase likelihood of having auditory feedback. So again, nak pakai macam ni boleh, but not for more severe losses. Kalau you tengok the fitting range ni up to about 50 dB tu okay lagi, 80 to 100% suitable. But then when it gets more severe, then you know, it probably not the right choice. This is the components. I don't want you to remember pun tak payah. I just want to say what are the basic components because it will help you to understand the function of the hearing aid. What is it there? You basically have the microphone to pick up the sound, environmental sounds, change it to electrical. And then you just have the circuit in here. You nampak ada receiver, ada amplifier. Alright, and then ada battery as a power untuk ear hook. So it's a very simple sebenarnya components dia. So sebab apa? So because of that, because it's just having amplifier kat dalam tu, the function of the hearing aid is really just to amplify the sounds. Alright, you understand what's the problem with people with sensory neural losses? What is the problem? What is the difference between those with conductive losses and those with sensory neural
Noisy
losses?
place in a noisy place, one is can hear better, one is see.
Recruitment, I heard that. Okay. Yeah? Noisy background? Yeah, okay. This is, I'm talking about when you have these conductive losses, the problem is really where? Outer ear, middle ear, right? Okay. And the cochlear should be normal. Should be normal. So when we say normal means what? Normal cochlear means what? Huh? Yeah. So all the hair cells are normal, right? It's functioning, it's doing all these things. So when it is the blockage or the problem is just at the outer and the middle ear, if you make the sound louder, then the sound can get in. Cochlear tak ada masalah, hantar signal to the brain. So they should be able to perceive signal. Okay lah kan, tak ada distortion or anything like that. But if it is cochlear is the problem, yes, you amplify the sound gets in, okay, and then all the sound sampai balik ke otak untuk the process. But then you have damage the outer and probably the inner hair cells as well if the hearing loss is very, very severe. So, and there's a lot of changes occur along the auditory pathway because of that sensory neural losses. Alright? So the signal that gets up to the brain untuk brain interpret now, it's not just about its reduced hearing tadi tu, you need to make it louder, tapi it's also distorted. It is also distorted signal. Distorted means, ni contoh orang kata dengar orang cakap tapi tak jelas lah, not clear. Dia dah tak sharp lagi dah. Orang kata, in our terms, we call it's the frequency resolution. Macam kamera yang good resolution, you have a very nice photo, right? But if it is less pixel dia tu, then of course you dengar tak jelas. So you hear people talking but it's not clear. Kita panggil this is the function of the auditory nerves actually to make it a very sharp tuning. For each sound that comes in, there's a very sharp tuning at the different parts along that basilar membrane sebenarnya. And that gives you a good frequency resolution for those with people with good name. Once you have a cochlear loss, you lost that ability. Dia punya sharp tuning tu dah tak sharp, dia jadi broad, jadi tau. So you lost the resolution. Jadi you dengar orang cakap, dengar tapi tak boleh nak dengar, tak boleh nak faham butir-butirnya tu susah. And it's distorted. Alright? So and that cannot be helped with hearing aids. Cannot. Even cochlear implant pun tidak. Yeah? So it helps to amplify the sounds, but it doesn't help to make them sharp, clear. Sekarang ni ada macam-macam teknologi, orang kata noise cancelling, apa semua, try to reduce the noise. Tapi if you understand, kita panggil macam auditory filters dekat dalam cochlear tu, once it's already been broad, it's not like macam kecil-kecil lagi kita punya very sharp, kita punya tuning curve ni, dia dah noise pun masuk dalam filters tu. So instead of just the speech sounds yang kita nak dengar, dia masuk juga noise kat dalam tu. So it's very hard to you faham fungsi filter tak? Filter ni dia dia allow those frequencies that you want to ni, but discard those yang dia tak nak. Tapi bila dah masuk speech sounds and also noise kat dalam the same filter, you think it's easy to take it out? It's not. It's not. It's not. Sebab tu you tengok all the hearing aid technologies, they give macam-macam cara and they say to improve clarity dan sebagainya, but it's actually very difficult. Alright, very difficult. So we need to understand that. Ni kan lama ni, tak boleh habis kan cochlear implant lagi. Okay, I'm going to be faster. Ini tadi saya dah cakap all these things. I have this video. So kalau I tak tunjuk video pun, but I just want to show you kat sini. If you can see that these different hearing aids, they are the different battery sizes. And kalau you tengok battery ni, dia macam battery jam, but they are not. They are not. And so if you see your patients, jangan suruh dia pergi kedai biasa-biasa beli hearing aid battery. Dia mesti dekat hearing aid centers, right? Because even though they look the same, they are not the same. These are batteries just for these hearing aids, the different types. And there's actually ada 4 types. Yang ini 675, kat sini 312. This is size 13, this is size 312. Beza yang ini walaupun diameter dia sama, tapi satu ni tebal sikit, satu ni nipis sikit. Alright. Dan ada satu lagi size 10 yang even smaller. That's probably a very very tiny punya sekarang punya RIC hearing aids. Okay, I won't play the video sebab kita kesentuhkan masa. There's another one, troubleshooting ni pun I just want to, kalau you all ni ada apa tu panggil apa? Stetoskop. Kita orang ada stethoscope. Stethoscope kita guna untuk check hearing aids. Do listening check. All audiologists when you come to the clinic, kita akan check dulu hearing aid sebelum we do any assessment. But we want to make sure hearing aid mesti in a good condition, good sound quality. Alright. So we have a battery tester. We also have the stethoscope. So battery tester is easy. Boleh you masukkan je battery kat dalam ni and tengok lampu tu whether it's like the light is on or not. Kalau you nampak dah dim aja, tahulah bateri nak habis dah nyawanya. Okay, so change it to a new one before you do the test. Sebab kita tak nak buat test dalam keadaan bateri dah separuh nyawa. Alright, and then we won't get the right results that we want. Or else, we also teach our students who must listen to do listening check before they do the test. Listening check ni untuk dengar sound quality. Kalau start dengar sound quality macam bunyi dalam air, it shouldn't be, then you know there's something wrong with this hearing aid. And we also ask parents kalau boleh beli benda ni so that they can test it every day. And then they will know. Or cikgu sekolah, it will be good as well to check it. Alright?
This is the last one.
We'll just skip that. Okay, I have to acknowledge the video actually was done by Dr. Chong Pung Yen with our clinician Puan Wan Hanim in shooting the video clips, and to Dr. Chong lah for sharing dia punya slides yang saya guna for this talk. Yang ni I just want to say, actually we have, when we do fitting, we have to complete all this. Hearing assessment, of course, you identify this is a candidate. Your hearing aid selection, this is when we select the features for the hearing aids. Features banyak ya, and kalau you realize the price of the hearing aids ada the whole range kan. Kita tak nak bagi semua, tak perlu nak semua the premium punya hearing aids. That it doesn't mean they need that, you know. Sebab the more features that you suggest, then it will be more expensive. They may not need it. Again, we consider a lot of things. So dalam kita punya hearing aid selection, ada a lot of things our students need to know when they select hearing aids. And then fitting, kita ada verification. Verification is when we do real ear measurements. Real ear measurements is when we actually measure near to the eardrum tu. Kita ada masukkan tubing kat dalam tu, and we measure the output at the eardrum. We really want to know macam mana hearing aid ni function at the eardrum the signal at the eardrum, because we don't want over amplify. You know, kalau pediatric, because dia punya canal will be very small, then you probably think you bagi macam this much amplification, tapi sebenarnya bila masuk dalam telinga dia, because of there's a very small volume, then they actually amplify a lot more, and you don't want to damage the child's hearing. Alright, you talk about recruitment. Beberapa kali I dengar, yes, recruitment is also something we need to consider, and that again we need to measure at the eardrum. So we have our targets. We use our prescriptive formula. We can select a few, and then and then you set the teaching targets. Orientation is when we teach these hearing aid users the components, macam mana nak change battery, bila nak change battery, we teach them kat sini macam mana penjagaannya dan sebagainya. That's the orientation. Validation is when we do outcome measures, because in the end is how do you actually function in the outside world. It's not in our clinic. Kita ada clinical measurements, tapi validation is more into how they actually function in the real world, luar daripada klinik. So bila saya letak a circle, because we always have at any point actually, if we need to do, when we do validation dan dia ada problem dekat situ, then we probably need to reassess and so forth. So I want you to understand that that's a process. Dia bukan pergi beli at the counter punya hearing aid, sebab banyak juga orang beli online punya hearing aid and then that's it. It's not like that. There's a lot of online punya hearing aid kat US, sangat-sangat a big issue. They probably boleh beli dekat supermarket dan sebagainya juga, over the counter punya hearing aids. But for a good proper management, this is the process that we need to go through. Other types I won't mention, but there's also BAHA, and there's also like what we call as cross hearing aids. So, Prof. Asma, can we just continue this, or how is it?
Another 10 minutes.
10 minutes. Okay. Cochlear implant, I go through very, very fast. Well, basically, we said this is yang tadi saya mention too about when you have a good cochlear function, then you have the outer hair cells and the inner hair cells function. Spiral ganglion cells, semua ada dekat sini. But when you have the impaired cochlear, then you lost the activity, the spontaneous activity of the neurons. And there's I said about a lot of changes occur along the way, along the auditory pathway, especially as the duration of deafness increase. Alright, so when this is the case, then we probably think the signal that they send acoustically when they need to pass through all this won't happen anymore, because of the severe losses, the significant losses. This is not working. Then that's when we suggest you fit with hearing aids and you do the validation and you see the results is not that good. So basically, kalau pediatric memanglah kita severe profound cases, I hope you all will be alert. From the very start nampak severe profound, alert them for management option for cochlear implant. Alright, sebab basically memang it's difficult with hearing aids. Alright, again, if they want to eventually, what's the outcome that they want? So if it is really to reconnect to the hearing world, then cochlear implant is the answer. Alright, so electrodes inserted into the scala tympani and direct stimulation of the spiral ganglion cells. Okay, so in general, the prerequisites, auditory nerves must be present, any middle ear disease must be under control. Alright, so basically you know that there are two parts, right? Internal and external. So again, how it works, this is the processor outside, yang the child is using, and again this is the implant. So sebenarnya bila kita cakap implant tu sebenarnya yang ini, yang bahagian dalam ni. Alright, So I use cochlear implant system. So it's a system when you have the internal and the external. It's a system. Alright. So microphone just pick up, and then all the processing, actually the coding of the signals actually happening in here. Sebab audiologists will do the programming, and the programming tu kita letak kat sini. This is the tempat dia punya, orang kata, the brain for the cochlear implant. Sebab the map tu is in here dalam speech processor. It's how dia code bunyi, the internal, dia code the sounds that get in through the microphone. Microphone kelak, right? And then it will be sent to the speech processor. So the programming or the coding of the signal happen here. Kalau audiology ni saya tunjuklah lebih sikit because they need to understand a little bit more of what is happening. I just tell you, for you probably didn't understand from the speech processor. Then signal, the coded signal will be sent to the transmitting coil, and then this is passed through the skin using radio frequency. Radio frequency transmission to the inside. This one yang you masukkan ke dalam ni. So ini we call it receiver simulator, the radio frequency receiver, yeah. And then decode the signal, send it to the electrode array for simulation, and directly stimulate the spiral ganglion cell. So the target cells in the cochlear implant is the spiral ganglion cells, right? Spiral ganglion cells is the target cells in cochlear implant. So dulu ada many years ago, there's a lot of studies looking at the if you have a lot of spiral ganglion cells, would that means you have a better results? But somehow there's another study that showed that's not necessarily is the case lah. Yeah, even though if you have a lot of spiral ganglion cells, would be good. Let's say for someone with a sudden loss, then probably there's still a lot of hopefully functioning spiral ganglion cells to stimulate. These are different systems right now, cochlear, nucleus, metal, the synchrony implant, advanced bionics, Ortcon medical. These are all in Malaysia. But the neurotron, this is the Chinese one. Right now it is just limited to the in China saja, not elsewhere. Alright, tapi yang all these four are available. Candidates, who do you think candidates? Oh, sebab masa tinggal pendek, I go through severe to profound losses. Semua ada pandang-pandang. Okay, severe to profound losses, definitely. Bilaterally, ski slope, hearing loss, and then this is in general, audiological criteria. Ski slope, hearing loss, and then as I said, single-sided deafness. Alright, this is in general. And then the types of fitting. Types of fitting, it can be unilateral. Most of our cases, when we first started, probably the first 10 years, they are unilateral users because the hearing loss actually very profound. We only implanted those with very profound losses, and so they already tak dapat benefit from hearing aids. So they basically are unilateral users. Then since 2008, UKM start with bilateral CI. Bilateral CI again for those with bilateral losses yang significant. Alright, but as the criteria evolve, now we are implanting those with more residual hearing. Not lagi kita kata orang yang really a dead ear. Dead ear tu, you know tak what is dead ear? You don't know. Okay. Ada orang yang tahu what is dead ear? We call it a dead ear if you don't get any response across the test frequencies. Sepatutnya kita expect low frequency at least ada kan, sebab vibration, isn't it? Ini yang itu pun kita tak nampak. Ini despite kita assess at the very maximum level on our audiometer. So kita panggil dead ear. Yang itu kena berhati-hati sikit kalau you dapat kes yang macam tu, sebab nak kena buat further itu. Tengok kenapa dia tak ada respon. Alright. Bilateral is when you use dua. We call it bimodal if you have one kat sini hearing aid.